Hi, my name is Janae. I'm 18 years old. I had a surgery 2 months ago. Before surgery, I had so much pain, and I had it for 7 years, around that, and it's driving me nuts. When I was placed for it, so much pain for, it hurts you when I breathe in, and there's a lot of stuff going on. When I came here to see Dr. Cheng, I was really nervous. Having surgery is a pretty big deal. I'm really looking forward to not having pain. I played volleyball, basketball, track, and field. Every day after practice, it was so much pain. Like when I was running, breathing, just like joking my back up and feeling so much pain.
Scoliosis is a common disease in the general population, as high as estimated 10% of the population. I would like to talk about a special person. She's very strong in her track and field. She has some issue with her hearing, so she wears a cochlear implant. She has a 52-degree scoliosis when she was 17 years old. We held off on surgical intervention because she specifically was looking to get college scholarships. As the time progresses, her pain became worse and her curve started progressing. Therefore, we knew we had to perform surgery. So this is a typical instrumentation that we use in a long scoliosis spinal reconstruction. As you can see, there are multiple screws that goes inside of the bone to anchor to the bone so we can manipulate the spine. The key things with the scoliosis deformity, since it's a three-dimensional deformity, what we need to do is anchor into the bone, rotate to its correct orientation, and also by compressing and distracting on the different part of the curve, straightening out the spine. Today, I'm specifically going to talk about a special technique called ponte osteotomy. Is after exposure, we'll remove the piece of bone and the ligament that goes into the back of those pointed projectiles called spinous process. After we release them, we'll go to the side and further release the joints that attach. Every spinal segment has a joint, just like a knuckle joint in the hand. We also have a joint for every single level in the spine. So after we release, then we use instrumentation attached to the screw to derotate the spine into the correct orientation. Then after we derotate, we use a rod to lock everything in when the spine is persuaded into the ideal shape that we would like to have, and locking it in. The surgery is, even though it's straightforward, is still a major reconstructive surgery. We do have to worry about spinal cord function. That's why during the surgery, there will be a neurologist with the monitoring team that monitor the spine. There will be a cell saver team that collect patient's blood and transfuse back to them if needed. There are special instrumentation reps that's present to make sure all the equipment, all the hardware is available. So even though it's something that we do routinely and it makes the spine radiographically very gratifying, but at the same time we have to do pay attention. It's still a big surgery. So majority of scoliosis in the population does not require surgery. But if it exceeds more than 50 degrees, or you're having symptoms such as pinched nerve, then a scoliosis reconstruction could be considered in the few number of cases when it does become very symptomatic and taking away your quality of life.
when I woke up, firstly I feel in pain, but I was on pills, a lot of pills for pain. I threw up a lot of tests of medicine. It was so much pain, suffer, frustrated. I can't move the other side on the bed too fast. I have to go slow, but it's so much pain. Like move over smaller. I've been taking medicine, but like after 2.5, I'm done with it. I don't need it anymore. I'm really look forward to go back, be the athlete, football manager, in like a couple months left. I'm appreciating that Dr. Cheng has been patient with me, but he's great. He told me everything before surgery. He told me the risk, and he's the awesome doctor. He made me laugh.